Hello and welcome to week one. So, this week we are going to spend time on understanding yourself and your role as a counselor and understanding others and that is in our relationship, the clients. And then also, we are going to learn more about ways of understanding and perceiving the self and others. And so, really, this introduction is having self awareness. And so, before we get to week four, where we're going to start recording, I really want to start by helping you guys have that self awareness and learning about some of the foundational skills. And so, I am going to be providing you demonstrations and counseling demos that are going to model the counseling skills. And I'm also going to share videos from like YouTube and other resources to help you guys have a model example of what counseling is. And I'm really hoping through this course and through your time with each other that you are going to acquire again those foundational skills in becoming a counselor. And so again, the anxiety is normal. I want you to use that to help you to learn throughout this process and use me as a resource. I'm here to help you, and I really want to have you all, by the end of this course, feel confident in the foundational counseling skills and your ability to apply those in a counseling session. And so today we're going again to talk about a little bit more about understanding the self. A lot of this pertains to multicultural awareness and understanding that we are working with diverse populations and how we don't want to um, put our value systems on our clients. And so we really want to think about how we can be a non-biased third party so that clients feel safe to explore any parts of their social identities, whether that's religion, sexuality, gender. And so we're going to talk more in depth today about having self-awareness about your own values and your own social identities and making sure that you don't impose those on your clients. And so there are some basic overall summary slides that I'm going to share with you about the skills we're going to learn. And so if it's overwhelming to hear about them, just know that we're going to go in depth about each of them. But I wanted to start by just mentioning what are some of the skills we're going to learn throughout this course. And so I'm going to share my PowerPoint with you, and we're going to go through the lecture. And then I may pause a few times from the lecture to come back and kind of share examples of the counseling process. So again, that you can see it being modeled. So let me share my screen with you all. I hope you're having a good day or night, depending on what time of day it is that you're watching this. So let me share my screen with you all. Okay, so again, this is chapter one, and the importance of self-understanding. And so knowing that we're complex beings, we want to be able to understand ourselves and have self-regulation and self-awareness so that we can manage the influence of personal bias and values and understanding the perspectives of others, which are our clients. And so today in this lecture, we're going to talk about the influence on personal development. And so these are social identities that we're going to talk through, in addition to stress and demands and how that can impact personal development. And then, like I mentioned, we're going to talk a little bit about the counseling skills framework. And so we're going to talk about the counseling process overall, and then a little bit about some professional skills, invitational skills, which really are more of those nonverbal skills, and interpersonal skills that we use, and then reflecting skills and challenging skills. So again, we're just talking about the counseling skills framework. There's not any application, and I really want you guys just to get an understanding of what we're going to talk about throughout this course. And so it really is essential that you understand your own personal beliefs before working with others. And so a big part of that is, again, so that you aren't imposing your views onto your client. And so that is one reason why our work in talk therapy is so effective, is because we are a non-biased third party that can provide a space for others to explore their own presenting concerns. And so there are multiple influences on how you see yourself and interpret the world around you. And so there's a lot of social identities that can influence personal development. So there's culture, there's race, there's ethnicity, your gender, your sexual orientation, your SES, spiritual and or religiosity, the life stage you're in. So you'll take a course on human development, and that is important to know and understand when working with clients at different developmental stages. Family of origin, we'll talk a little bit more in depth when we get to these slides, but family is a part of every presenting concern that I've worked with, because we are such social beings. The family unit and primary caregivers really does have a big impact on the mental well-being of others. And then abilities and disabilities, and then also how level of stress and demands in your life can impact personal development. And so we're going to go through each of these, and I'm going to share some examples to kind of add to what you read about in your book this week. And so as counselors, there's a few things that I think are important that every counselor has and characteristics. And one of those is multicultural competence. And so this is a significant predictor of satisfaction in counseling. So to be multiculturally competent is really being able to have knowledge in multicultural areas, and it's being open, if you don't have competency within an area, that you're open to learning with your client and able to do some psychoeducation outside of session to help increase your own knowledge. So a good example of this is I had a lot of clients when I was working with medical students who were Muslim and practiced Islam. And so I had to learn a lot about that religion that I didn't know through working with my clients. And outside of session, I was doing a lot of research myself to make sure that I was multiculturally competent in the way that I was working with my clients. And so difficulties can arise from unacknowledged differences in perception. And so when I was in my counseling program, I remember a few times broaching is when you bring up differences in social identities. And so I'm a white female, and let's say that I was working with an Asian male client. Broaching, sometimes if it's more direct, maybe like, I noticed that we are both different sexes and that we both are of different races. Some people, may broach it in a different way, but I think it's acknowledging that there is differences in every interpersonal relationship based on social identities, and being comfortable broaching those topics if needed to help understand the dynamics of the counseling relationship that you have with each of your clients. And so as a practitioner, it is critical to examine your beliefs, your own assumptions, your biases, and their invisible influence on your perception. And so a good example of this is I grew up in a very, let's just say that there wasn't a lot of openness of sexuality in terms of the LGBTQ community. It was majority white, and so I really, until I went to college, didn't have a lot of experience of interacting with people from diverse populations. And so although I would say that, of course, not everybody I went to high school with was heterosexual, that there wasn't a space or a safe space then for people of the LGBTQ community to be open. And so when I went to college in Chicago, it was the opposite of that, where DePaul University was very welcoming and open. There's a LGBTQ Allies Club and a lot of courses on sexuality and sexual identity. And so I grew a lot because I had a lot of invisible influence maybe on my perception of the world because I wasn't educated and that I didn't have that experience. And so again, it's important that we understand that yes, we all grew up in different family units, different cultures, and that those experiences have shaped us. And it's our role as counselors and our professional identity to be multiculturally competent and to take courses and to learn more about differences based on culture, race, ethnicity, worldview, and how that can really impact the way in which we behave and the way we interact as counselors. And so cultural aspects to consider is acceptable roles, level of acculturation, expectations of practitioners, and communication patterns and particular beliefs. And so when I was working again with college students, there was different levels of acculturation for international students. And so that was something that I broached the topic with and really learned that that was something that was contributing to students who were international to their mental health concerns, because there was such a difference in level of acculturation, not only with me as a counselor, but with their peers and their professors. And so again, you want to think about all the various cultural aspects that may impact the counseling relationship. And it is difficult for those who are in dominant culture to identify the influence of their own culture as is accepted as the norm. And so as a white female, some of my perspective is limited and white privilege, and it's important that when I'm working with clients who are non-white to really be multiculturally competent and open, and that I'm not projecting my own heteronormative views onto my client. And so again, self-awareness, self-reflection are really going to help you to develop your own cultural identities. And so the multicultural course, you take that next semester in the spring. That is going to be a place where I hope you each grow and you really start to understand where your beliefs and assumptions originated from, and how you may have developed privilege in some areas, and how that can then impact some of your personal biases, and how can you remove those, especially when you're working with clients who are of different cultural and social identities, which is inevitable because we're all unique individuals. And so you are, even if you're like let's say I worked with a white female, we may have differences in SES or religiosity or sexuality or gender identity. And so you can't assume because somebody looks similar to you that they have similar beliefs. So speaking of gender, gender stereotypes are how a person should respond to life circumstances and whether behaviors are considered pathological or adaptive. And so gender really is socially constructed. This is a flag of the gender fluid flag, and it acknowledges that gender can change over time. But we really want to be careful that we don't have gender bias in counseling, because it can really then project some of those stereotypes that we may have about gender onto our clients. And that is not going to create a safe space. And then we may not be able to hold that space for that person. And so gender stereotypes, again, it's when we consider maybe a behavior pathological or adaptive. And so we see that, for example, there is a lot of discrimination towards individuals who are trans, meaning that it's individuals who do not identify with or conform to gender roles assigned to their sex. And you can see how hard trans individuals have had to fight for equality, whether that's in the workplace, within healthcare. And so it's important, again, to know the influence of gender on your own personal development and being aware of gender bias. And then in addition to sexual gender, we want to think about sexual orientation. And so that is the direction or directions of one's sexual, affectionate, emotional, cultural, or loving attention on a continuum only same sex to opposite sex attraction. And so that is where we get the acronym of the LGBTQ IQ plus, lesbian, gay, bisexual, trans, intersex. I've heard queer only being appropriate if you identify as queer as saying it, or it could be offensive if you say it and you're not part of the community. Questioning, and then the plus is acknowledging that you know, you could be asexual, that there's more sexual identities maybe that are not part of that acronym. And so embedded in sexual orientation, again, is stereotypes. And so a good example of this is, let's say as a clinician, you ask uh, um, female client if, do you have a boyfriend, right? That's heteronormative, and that's a stereotype, assuming that person's sexual identity is going to be heterosexual. And so we really want to think about, you know, like, are you in a relationship, or can you tell me about your partner? I now call my husband my partner. I sometimes say husband, but really it's to acknowledge that they're taking away gender in identifying the partner. And then in terms of sexual orientation, we kind of think of the ways in which we ask people about the relationships they're in. So, you know, are you dating versus do you have a boyfriend? Do you have a girlfriend? We don't want to assume sexuality again and impose our values onto our clients. Questions like that from the get-go, a client may not come back to you because they may not feel safe. And if they are part of the LGBTQI, you know, community, then they may not feel recognized by you if you are already displaying some of those heteronormative stereotypes. And practitioners are not immune to heterosexism. So again, like, it's something to be aware of with your own sexual identity as a practitioner, that knowing that there is going to, you may have stereotypes or biases based on your own perception, and to, again, not impose that onto your clients. So as practitioners and counselors, we have to be both aware and knowledgeable of the impact of heterosexism and homophobia on ourselves and on others. And so this will help contribute to deconstructing the bias and helping to have practices where diverse populations can receive services and feel welcomed. And so SES can also influence personal development and understanding yourself and others. And so SES refers to the position in social hierarchy as attributed to variables such as income, occupation, and education. And so we have to be cognizant at, you guys are education-wise at the master level, and so you may be working with individuals who may not have a high school degree. And so being cognizant of that when you're talking with them and doing therapy about the educational level, and to not impose, you know, that because you have a higher educational level that you're higher on the social hierarchy, but to really meet their client where they're at, and to be understanding and open about their income level and occupation, education. And something that we're going to talk about and continue to talk about too is that in the multicultural course is the intersectionality of all these social identities. And so you also, you know, when you think of intersectionality, it can be in terms of religion. You might have somebody who is white, Jewish, female, and coming to work with you as, let's say, a counselor who is male, and they are atheist. Then you have to think about, okay, we have different cultural identities, and that's okay. How am I going to work and provide space for this client who practices Judaism to have a space where they can, if it's important, share their religiosity within our session? And then the influence of spirituality and religion. So I just brought that up, but we want to be aware about our own personal beliefs and not use or abuse our own religious or spiritual beliefs to then influence others. And so we really want clients to be able to express their own beliefs, and we want to honor that by respecting that diversity. And I know I'd mentioned Islamic faith I had to learn a lot about when I worked with medical students, and I also had never heard of Sikhism. And so that is actually the third most common religion in the world. This is because I did some research on it, and I hadn't even ever heard of it. And so that kind of shows you sometimes the privilege I have in being, not aware of these other important and common religious identities that are more common in Asian countries. And so my client informed me a lot about what Sikhism was, and I also did a lot of my own research. But really, it's more about it's like kind of Buddhist and being whole, and kind of seeing there's a lot of spirituality aspects of it, but more about holistic wellness. And so, yeah, I'm not sure if you've heard of Sikhism, but if you haven't, I hadn't either. And so that is something one of my clients taught me, and I became more multiculturally confident through it. And then the influence of life stages are influenced by your biological development. You guys are going to take human growth and development, and that's really going to help you understand how different stages of development can then influence the life stage that an individual is at. So practitioners help clients deal with challenges at certain life stages. So whether that's family planning or career transitions or parenting skills, there's different parts of life that are going to influence the work you do with different populations and where they are at within those stages of life development. And then family, I had mentioned this, but family has influence on all my clients. And so it doesn't matter if it is a blended family or if somebody grew up in the foster care system. It really, family, however that's defined, or primary caregivers, influence the development of, emotionally and psychologically all people. And so there is going to be times where I've had sessions that were focused just on the influence of, family of origin, and then other sessions where maybe it's not primary, but it's still impactful. And so we want to be aware of how our own family of origin may influence our worldviews, and knowing that your own lived experience is going to be unique. And again, I've said it over and over throughout this lecture, but you don't want to impose your own views or your own values within your family onto others because they grew up with a different family with different social identities, and they have a very different lived experience. And so in your own self-awareness and self-development, you really want to think about how your own value and belief system may have been affected by your family, and helping to recognize maybe where you develop some of your own values that are influenced by your family, but then being able to understand that our clients also are going to have different family experiences and values that are going to impact their way of being, and being open again to inviting our clients to express and share their own experiences of their own family of origin. And this is just acknowledging, like I said, there's a lot of people who are referred to as family, so that may be primary caregivers, that may be an aunt, that may be parents, that may be siblings, that may be friends or church members. And so you can think that there is a wide range of family that can influence personal development. And then we also want to consider disability and ability. And so what are your own feelings on your own ability or disability? And it can profoundly influence your self-perception. And so I really like this saying, it's not a disability, it's a different ability. And knowing the privilege I am I have privilege as being an able person cognitively, physically, and mentally. And so the privilege of ableism is something that I had to reflect on a lot in my master's degree. I actually worked with an individual who was bound by a wheelchair, and we were talking about depression. And I had a lot of conversations with my supervisor that there was this elephant in the room that I wasn't acknowledging that he had a disability and how that was impacting his depression. And that came from my privilege of ableism and my own discomfort. And so I had to work through that and learn to be comfortable, but also put away my own privilege and ableism and really think about how this individual's mental health was being really impacted by the limit of the things they could do physically, but maybe that some of that was my own bias. Like there's things they can do, and how could I help them to recognize and see that it's a different ability, not a disability. And so I grew a lot from working with a client with a physical disability. And then disabilities come in all shapes and sizes. So an intellectual disability, somebody may be coping with a learning disability, they're not all visible. And so thinking about too your biases that you may have and maybe are unknown because you interacted with somebody and you didn't know that they had a disability, and thinking about how you can be welcoming and open and neutral in helping and learning more if you are uneducated in different areas of disabilities, and that there are developmental disabilities that can be more severe and chronic. And so if you're interested in working with populations of individuals who do have more severe and chronic disabilities, that there is a really big educational piece to that, and making sure that you're multiculturally competent to work with that population without imposing your own bias or privilege of ableism if you have it. And so in the past, many people with disabilities were isolated from mainstream community. We're seeing that change, but there's still a lot of work to be done. Today, there are a lot of legal protections for those with disabilities, and people first language avoids subconscious dehumanization. And so you can read more about that in your book, but really just again being aware of what parts for you are, if you do have ability, and then experiences that you've had of forms of disability and how that's impacted you and your well-being, or maybe a family member, and then thinking about how you can have empathy and a space for clients. And so, again, I know you can read more about it in your book, but the people first language is a form of language aiming at avoiding perceived and subconscious dehumanization when discussing people with disabilities. And so, reframing the language we use. So, instead of saying that autistic boy, it's really, we want to say that boy with autism, or a handicapped woman confined to a wheelchair, say a person with a disability who uses a wheelchair. And so now I'm reflecting on when I just shared that client narrative. I said I had a client I was working with who was physically disabled in a wheelchair. So yeah, I guess I was using that people first language. That's true for any mental health concern. So instead of saying a depressed woman, we want to say a woman who's coping with depression, right? So that's that people first language that we want to use when talking about clients coping with a disability and in general with mental health concerns. And then the influence of stress and demands. So as clinicians, we are listening to the narratives of clients. That includes transitions, adjustment, grief, trauma. And so there can be a lot of stress and demands on us as counselors. And that's why I know you're going to hear this throughout the program over and over, but self-care is so important. You can't pour from an empty cup, right? You need to water yourself first, as this analogy goes, right? Or this metaphor, that you really need to think about, and especially during the skills course, when you're starting to work with a partner, although you're role playing, you can start to think about what can I do to take care of myself, because my profession is taking care of others. And so burnout is not uncommon in our profession. I've experienced it. I've shared with my supervisor. I've taken breaks. I've maybe had clients who experienced trauma and asked if, when I got a new client, if I could have a presenting concern that was more transitional or about a different developmental life stage rather than, let's say, grief and loss, or something that was more traumatic and would take a more emotional toll for me as the counselor to hold that space for my clients. I actually had a colleague who works with predominantly clients with trauma, and she told me her max of clients presenting with trauma is 4 a day, and that she has to have a mix of other presenting concerns. But if she's doing solely, is that a word? Counseling for individuals with trauma or trauma work, that it can only be up to 4 clients a day for herself. So she set that boundary. For me, I prefer like 2 if I'm seeing 7 people. But it really is just being able to have that balance between knowing as the counselor we are the tool and we're the ones that are navigating and holding space for that therapeutic process, and we have to take care of ourselves in order to then be able to provide that space to clients. And so we want to think about what are some of our own self-care strategies to help prevent compassion fatigue or secondary traumatic stress, because these are things that can happen if we don't implement and take care of ourselves. And so you want to start to think about how you can develop creativity, the love of learning, humility, and other qualities as part of your work as counselors, and really starting now to think about what self-care looks like for you. For me, I would say self-care looks like going to bed after I put my kids to bed at 8:30. That sounds so early, and there's so many things I could do in my house or to prepare for the next day, but like I need sleep, especially because my son still wakes up frequently during the night. Self-care can look like setting boundaries and saying no to things you don't want to do or saying yes to things you do want to do. It can also be, leisure activities, physical activities, mindfulness. And so I really want you, as you're going through this lecture, to kind of start thinking about what does self-care look like for me, and how can I start implementing it in this clinical skills course as I'm starting to learn what it's like to hold space for others and to help others as my professional role. And so now we are going to transition into the counseling skills framework. And so if you have any questions about understanding yourself and others in chapter 1, please reach out to me and let me know, and I will go through that with you and help you to learn and make sure that you have a good understanding for that first chapter. And so I also, like I said at the beginning of the lecture, wanted to provide you all with some of the counseling skills framework that we're going to be talking about for the remainder of the semester. And so as a counselor in training, you want to think about 3 things in terms of counseling skills. You want to think about your way of being, your way of understanding, and your way of intervening. We are going to focus in skills 1 mostly on your way of being and your way of understanding, and then the way of intervening is going to be in skills 2 when you learn more about techniques. I wanted to share with you this website. I'm going to go to it. So actually my colleague at Oakland University developed this website, and there's classes based on topics within the Masters in Counseling program, and you can see counseling skills right here. And so I wanted to share this with you because there's great resources. And so if you want to learn more about the counseling relationship, you can navigate this part of the website. But the counseling skills list, this is, oops, that's weird. Sorry, let me get back there. The counseling skills list, as you can see, it breaks down each of the skills that we're going to talk about. So invitational skills, reflecting skills, challenging skills, professionalism, and goal setting and conceptual skills. So invitational skills, we're going to talk a little bit about those today, but again, there's information on what those are. Some of them have videos, and so this is just a website that I want you all to use to at your discretion, but I think it could be helpful in kind of having an understanding of what the counseling skills are as we start to learn about them and apply them in your didactic sessions. Okay, so this is a very simple slide, but I really want you guys to think about in counseling. Counseling is a process, therefore, as clinicians, we need to trust the process. When I first started seeing clients, I wanted pretty much just a rule book of what to do, and I wanted to know what to say next, and a guide of, a person presents with depression, this is what I do. And really, that's not what counseling is. You will see it once you experience it and you feel it, but it's really a process in meeting somebody in their space, being authentic, and allowing them to explore their own emotional world and their subjective experiences with you, and being able to sit with them through that process of healing. It, again, there's not a textbook on, there are lots of textbooks on what to do, but in terms of like what actually makes therapy work, it really is the relationship and being able to sit with somebody and hold that space for them, and really trusting that the process of counseling is going to help them heal. So that's just something I want you all to think about as we're starting to practice role playing counseling sessions for the first time. And so for professional skills, especially for this course, it's important that you're open to feedback. Feedback is, I remember in my master's program, I'm a perfectionist. I would like to get all A's. I really cared about my grades, which was great, but that really doesn't help with the applied part of a counseling program. And so I had trouble, I think, at first accepting feedback without being defensive. And I also learned so much through feedback that through my practicum experience and internship, I became a different counselor. I became so much more well equipped. I had way more skills. I really understood the process, and that was because I allowed myself to be open to feedback. We also want to think about our ethical codes. So you guys are going to learn more about that in the ethics course next semester, but we really want to just think about doing no harm. How can we benefit our clients, and how can we make sure that we're being just and fair. And in terms of professionalism skills, we want to think about, in particular to this course, the content in what you talk about within your client role plays. It's important that it is something that you can talk about that is, honest and authentic, and it's also not too complicated for the counselor role playing to help you work through. And so good topics to talk about can be like relationships, transitions, careers, things like that. When we get to trauma, if you're coping, with suicidality, please reach out to me if you need help connecting with a resource or a counselor out in the community. I'd be open to helping you do that. But these client role plays with each other are not for that. So in those didactic sessions, again, I want you to focus on a topic that's authentic. I know in a lot of counseling ed programs, they talk about that you can like be an actor or actress. You can, but it's going to be really hard to have 5 sessions and to be authentic if you're not talking from personal experience. So then I guess as we're navigating through these first few weeks before we have our first tape that's due, I want you to kind of think about what you feel comfortable talking about. So for me, I talked about my grad program was in North Carolina at UNC Greensboro, and my family was back in Michigan, and my partner at the time was in Chicago. And so I talked about the long distance, social isolation, the competitiveness of my grad program, and I felt comfortable to talk about all those things. And it gave space for the counselor in training who I was working with to practice some of the foundational counseling skills. So again, we're not talking about severe grief or loss or trauma, or if suicidality or self-harm. If you are experiencing those things and you need, if if you are experiencing any of those things and you feel like you're in imminent danger, go to the emergency room. However, if it's something that you've been coping with and you're having suicidal thoughts and you want to be connected with a therapist and you're not, of course, reach out to me and I'll connect you to someone. But I just wanted to make sure that I emphasize that these didactic role plays are not for providing counseling that's trauma informed. It's really just having a space to be able to have the counselor in training learn how to apply the basic counseling skills. So let me know if you have any questions or concerns about coming up with a topic to talk about. Again, you want to think about things like transitions, relationships, career, trajectory, things like that. And then supervision, I cannot emphasize enough. I seek supervision, even being fully licensed and having my PhD. I continue to seek supervision from my colleagues. And so it's so important that in this field, you don't just become a counselor and then don't seek consultation or supervision from others. We are constantly, coping with ethical dilemmas or maybe some moral dilemmas and things that we may have some transference or counter transference, and so we really need to explore that with somebody else. And so that's why supervision is, we have it, you all have it through me in this clinical skills course. You'll have it in skills 2 with all the feedback you're getting and the supervision because we watch the tapes. And then in practicum, you are recording sessions. Again, you're going to have lots of group supervision and individual supervision, and that's the same into internship. And so never stop seeking supervision. It's a vital part of our profession and maintaining, your professional identity, being ethical, and continuing to be multiculturally competent. Okay, so now the first skills that we're going to talk about and the first skills that I'm going to be looking for that first time you do a recording is going to be these invitational skills. We're going to go more into them, but really it's about your nonverbal communication. So are you attending to the client? Are you providing minimal encouragers? So that's when you nod your head like, mm-hmm, or you say, yeah, okay, I'm with you. You can, verbally say something, or you non-verbally can nod your head and give that encourager to the client that you're attending to what they're saying. You also want to think about your timing and pace. I know when I first started counseling sessions, I talked super fast. I still talk a little fast. I'm working on that. But you want to think about the timing and pacing, especially with what the client is talking about. So you really want to match the tone of your client. So if they have a low and slow voice, we want to match that voice. You don't want to come into somebody who's depressed and talking in a more low and slow voice and be like, hi, welcome to counseling. I'm so excited to work with you. What's bringing you in? Although that may be friendly, you can see how that is not an invitational skill to somebody who's mentally and emotionally not at the same place. And so we want to think about our timing and pacing in the session. And we'll talk about some of these other skills, but silence is so important. And so I remember feeling so uncomfortable with silence. I'd get uncomfortable in my body. I would just want to ask a question. And really, now that I've had years of clinical experience, I think silence is one of the best tools that I have. It allows your client to process. Think about when you're emoting or you have emotion, like you can feel it in your chest or in your body and it's there. If a counselor can recognize that and give you silence, you can allow yourself to feel it. If your counselor asks you a question as that emotion is starting to arise, then you're going to move to cognitively responding, and you're going to ignore the emotion. So then again, the counselor actually just did a disservice to the client by ignoring or suppressing that emotion and making them answer a question and thinking cognitively instead of allowing them to express their emotion. So silence is one of, I think, the best skills to use as a counselor. I know, again, in my beginning counselor years that I would ask questions to fill that silence because I felt uncomfortable with it. And through practice and experience and supervision, I realized the impact that silence can have on therapeutic progress. And so definitely think about that as a skill. I am going to stop sharing my screen because I wanted to show you guys something. So another thing with invitational skills is nonverbal. It's hard because we're an online program. I'm teaching you asynchronous, but I do this when I taught this course synchronized. But let's say I'm the counselor and I'm sitting in my chair. Now, this is what I would say would be more of an open stance. Okay, my hands are, comfortable. I feel comfortable. I'm, attentive, and I feel comfortable in my body. Now, what about if I'm sitting like this? Welcome to counseling. Hey, how can I help you? This is super closed off. So we want to think about in our nonverbal communication, my legs are also crossed, you can't see, but how can you be open and comfortable? I've had people or supervisees who sit like this. This looks open to me, right? Like my shoulders are open. I'm leaning in, especially when clients start to talk about something that's more traumatic to them, or there's a lot of grief associated with it, or they're emoting and they're overwhelmed. You can lean into the session and lean into that person and like attend to them. Like, I am here, I'm listening. Whereas like if someone's crying, you don't want to be like that, right? You don't want to be like, when I first started seeing clients, I was squeezing this so hard because I was so nervous. But like that, your clients can feel that, right? Like you don't want to present super anxious as a counselor as you're helping clients with their mental health. So think about what's comfortable for you. Do you like to lean to one side? Do you like to cross your legs? Do you like them uncrossed? Do you like to have an elbow up? But whatever you do, you want to just make sure it's open. Have, open shoulders. Some people say don't cross your legs, but I think if you feel comfortable that way, then it's going to come across as comfortable to your client. And so just thinking even non-verbally, like how you're presenting. Some of those minimal encouragers that I shared with you are like things like nodding your head. You can say, okay, yeah, I'm with you. But do you see how like that's bringing, that's letting the client know I'm attending to them, is by sharing these nonverbal languages instead of just like, or, I think I've heard of some counselors like falling asleep. And so that is obviously a no-no, and that is not helpful to your client, that you need to be present. And so thinking about, what's comfortable to you. Is it comfortable to like lean a little forward? If that client's moaning or needing more comfort, can you lean into them, and not being like, oh, they're really upset, what do I do, right? So I just wanted to show you that all. Again, that was a little, maybe some extreme, but even on telehealth, you can see, the response of your counselor. So, yeah, I'm with you. Yeah. Like just giving them that, space to know that you're listening and you're attending to what they're saying instead of just like, or eye contact. Like if you're just like not looking at them, obviously that is not being attentive. And so you want to make sure that you, whether it's telehealth or in person, that you are giving them direct eye contact. So those are all nonverbal invitational skills that welcomes our clients into our space and letting them know that we're there for them. Okay, so now I'm going to share my screen again, jump back to the lecture. Oops. Okay. So we just talked about invitational skills, and now we're going to talk about reflecting skills. So again, I'm not going to go too in depth. I don't want to overwhelm you all, but really what reflecting skills do is, I really like this iceberg metaphor. When you talk to clients and they come in, especially in those first few sessions, depending, again, there's variability, but it's usually pretty surface, right? What they're coming in with, I'm feeling anxious, I'm not getting along with my partner well, I need more coping skills. And then by using our skills that we are going to learn throughout this course, like reflection of content and paraphrasing. Paraphrasing is just what it is, paraphrasing back what you heard. And when we do that, the client can hear what they said through a different perspective, and it can also validate what they're talking about. It also, as the clinician, lets us know if we are understanding the client. I have done a paraphrase and a client's been like, no, that's not right. And instead of being defensive or reacting to it, I'm like, okay, can you let me know and share a little bit more about what you mean? So again, really just meeting that client where they're at, and you want to just provide space that they're being heard and seen. And so when we start reflecting content and paraphrasing, and then even deeper than that, we start reflecting feeling. You're overwhelmed. You are experiencing some resentment towards your partner. Or, yeah, it sounds like you are really anxious right now. Um, those are all going to take our clients underneath this iceberg. And that's going to help us get to these more deeper meanings that have emotional factors rather than just more of the thinking. A lot of our clients come in and they feel safe talking about certain things. Like, I can think about this, I can reason it. But then the moment you start to reflect those emotions, it really opens up a new door where they can start to process the emotion behind their experiences in their narrative. Same is true for reflection of meaning. And so a typical reflection of meaning can be, it sounds like, let's say there's a scenario where a friend is in an argument with her friend because she didn't invite her to a dinner with all the other girlfriends in their friend group. And the counselor has heard about this relationship for a couple weeks, and then she is seeing how distressing it is. So then a reflection of meaning could be, you want to make sure you have a relationship with your client before you reflect meaning. You want to make sure you have a holistic understanding of who that person is. But you may say something like, it sounds like so and so is your really close friend, and you're really hurt because that relationship is so important to you, and you are feeling like she's discluding you. That would be a reflection of meaning, okay? Like acknowledging your hurt, acknowledging that relationship means a lot, that acknowledging that you don't feel included, and that you're feeling ignored. And so when you do that, that again is going to help take your client underneath this iceberg. So I always, when I'm teaching these skills, I love this metaphor. Like, how can we get under the iceberg with our clients? And so when you're role playing with one another, some of my feedback would be like, how can we get under the cognitive iceberg and get more to that emotion? What could we have said here that would help the client move deeper meaning? And then I'll help give suggestions to help increase your skill level. But we're really, as counselors, we want to be under the water in the deeper meaning, right? We don't want to stay on the surface with clients. I also like this depiction. So like, clients come in, I have all these issues going on. These are my presenting concerns. But what's underneath that? Their personalities, their emotions, their interests, their needs, their self-esteem, unresolved trauma, hidden expectations. Those are all going to be what's underneath the surface, underneath this iceberg, and we want to help unpack that. That's what our role is as counselors. We're going to use these skills, although they seem basic and they are foundational skills to our profession. These can really help people move underneath this iceberg to the deeper meaning. And then lastly, we're just going to briefly talk about challenging skills. This is what we're going to talk about towards the end of this semester, or this first block, this first 8-week block. But immediacy is when you acknowledge in the here and now what's occurring. So let's say I have a client that I'm working with, and she's talking about her relationship with her father, and talking about what it was like growing up with him, and I start to notice her eyes are watering. I may use immediacy and say, hey, so-and-so, hey, Sarah, I noticed that when we started talking about your dad, that it really started to upset you and your eyes are starting to water. That literally, then the client has to acknowledge the emotion. They're in the present moment with you. And so immediacy is one of my favorite skills, but it has to be used as all other skills, but especially immediacy with intentionality. And so the reason why it's categorized as a challenging skill is, you can see that is like a really it may be a soft challenge, but it's vulnerable, right? You're acknowledging that somebody is about to cry and that a certain relationship in their life is causing them pain. Immediacy, again, it can be a strength. It can really help. And you have to be careful and intentional with using it, that you are not going to push your client or, provide them a space where they feel not safe. Other challenging skills can be psychoeducation, interpretations. Interpretations, those take time to develop, and so that's when you maybe are seeing a theme or connection throughout a client's narrative and you provide an interpretation. So you would see why you'd have to know the client for a long time before making that interpretation. And then confrontation, that is a more challenging skill that's not as soft, it's more direct. And that could be, let's say somebody is coping with anxiety and they're coming in every week super anxious, and you're talking about coping skills and things they can do, and they come back each week and they're not implementing it or trying any new coping skills, and their anxiety continues to be really high. You may confront that and say, I noticed, David, that we have been trying to manage your anxiety, and each week we're talking about all these coping skills that may be helpful, and I'm noticing that between sessions that you aren't really finding time to implement that self-care. I'm wondering what's getting in the way of that. Again, a little more direct. I think to confront, you have to be more comfortable with the client. You have to be comfortable with your identity as a counselor. But again, these are all skills that are helpful in the therapeutic process and helping a client to acknowledge, for that client particularly, that the anxiety is not going away because maybe you're comfortable with the anxiety. Maybe you've always been used to it and you're not actually working on decreasing it. Maybe it feels safe to just always be anxious and not really lean into maybe some of those emotions that are underneath the anxiety. And then repairing relationships. And so this is actually called the rupture repair, can't think of the term, the last part. Pattern. Yeah, let's just call it that. But the rupture repair pattern, where there are going to be therapeutic ruptures, meaning you may misinterpret something, you may try to broach a topic and it may not go well, you may have not be as multiculturally competent in an area, and you may offend a client. But the thing that's great about counseling relationship is that as authentic beings, we can repair those relationships and acknowledge when we're wrong. And so I think that it is naive to think that as a counselor you are the expert and you know everything. You don't. Each client is the expert of their own lives, and you're actually being welcomed into their space. And so you want to think about how important it is that, ruptures are going to happen, but repairing is something that needs to happen. So in any interpersonal relationships you have, if it's something you care about and you want to be healthy, then you are going to repair it. So as counselors, we always want to repair any ruptures we have with clients. There may be, some anomalies where a referral may be more appropriate, but in general, we want to repair those relationships and acknowledge, if we have hurt a client or if we were misinformed or being multiculturally insensitive. And so I'm going to have you all watch this on your own, but this is a really good TED Talk about reconsidering psychotherapy. So I think that you all believe in therapy and the effectiveness of it and the efficacy of it. But this video, I think, just emphasizes how therapy can work. It's a psychologist sharing her experience through her own personal counseling and then working with clients herself. And so I want you all to watch this TED Talk, and it kind of just summarizes it and gives a good talk about the importance of psychotherapy and how it really talk therapy can help people heal. So if you're not already bought into counseling as a profession, I hope you are, because you're here. Then that video, I love TED Talks. I think they're genuine, they're authentic, they're by people working in the field, and it can give us a lot of perspective. So let me know if you have any questions about chapter 1. And I introduced all the skills to you that we're going to be talking about in this first 8-week block. So let me know if you have any questions. I look forward to working with you all and getting to know you more. So yeah, have a good rest of your day or week, depending on where you're at. And I look forward to talking to you this week again about chapter 2.